What precision medicine means to me is personalized medicine or tailored medicine to the specific patient, their particular tumor or cancer type, rather than just treating a broad spectrum, but more specifically that particular patient's cancer or tumor type. One of the things that just really jumped off the page for me from a Tempus standpoint was they just are really going to push the envelope on getting targeted treatments and therapies for patients instead of kind of just doing what we've always done. And I think that's exciting from a clinician standpoint and for the patients. And then of course the next part is quality, like how good is the test? How accurate is the test? It got to be a more of a one-stop shop where rather than sending patients to 2 or 3 different locations in order to get the same information, we could get all of it through Tempus. It was so much more convenient for them to be able to get everything done with one testing, one company, one set of results instead of kind of mixing and matching moving forward. The HRD, especially for gynecologic cancers, has been huge, right? I mean, we have Payola-1, we have data that show that maintenance therapies are more effective when there's an HRD positivity. We definitely utilize that HRD to guide us in terms of our maintenance therapy options, PARP inhibitor options, etc. It's been extremely important. One of the parts from a clinical standpoint or a clinician standpoint that really separates Tempus from everyone else is the data platform. Like being able to go in and log in and look at specific tumor mutations and compare them to other patients that are in the database from Tempus and say, okay, that treatment option did not work as well with your tumor or your tumor mutations, but this treatment did. And so going all the way back to the precision piece of this, really picking out specific treatments for patients that we can now look into a database and say, this is a better option for you, this has a better effectiveness or efficacy rate than this, and try to prolong people's lives through that data piece, I think is huge. And the other thing is the trials. I mean, time trials and the trial options that Tempus has, I think, are amazing. And I think that's really, again, that's what fits in with precision medicine and offering patients opportunities to get treated with a specific treatment that is very specific to their tumor mutation and their tumor, as opposed to kind of blanket treating them like we've always done in the past, is really getting pushed from Tempus. So that's super exciting to tangibly see, in our practice and what the opportunities in the future may look like as patients have more and more opportunities to get these targeted or immunotherapy options or very specific treatment options that they never had before that will extend their lives significantly.